Welcome to Vagina Anatomy Explained, where we'll take a deep dive into one of the most fascinating parts of the female reproductive system. Whether you're here for education, curiosity, or health reasons, understanding vaginal anatomy can empower you to make informed decisions about your body. Today, we'll cover the external and internal structures, how it all works together, bust some common myths, and share tips for maintaining vaginal health. Remember, everybody is unique, and this is a general overview. Always consult a doctor for personalized advice. Let's start with the basics. The term vagina often gets misused. Technically, the vagina is the internal canal, while the external parts are called the vulva. But don't worry, we'll clarify everything with clear animations.
Let's begin externally with the vulva, which includes all the visible parts. At the top is the mons pubis, a fatty pad that cushions the pubic bone and often has pubic hair for protection. Below that, we have the labia majora, the outer lips, which are folds of skin that protect the inner structures. Inside them are the labia minora, the thinner inner lips that vary greatly in size, shape, and color from person to person. No two are alike, and that's completely normal. Next, the clitoris. This is a powerhouse of pleasure with over 8,000 nerve endings. It's mostly internal, but has a visible glands at the top where the labia meet. The clitoral hood covers and protects it, similar to foreskin. Below the clitoris is the urethral opening, where urine exits, and further down is the vaginal opening, or intratus. Finally, the perineum is the area between the vaginal opening and the anus. All of these parts work together for protection, sensation, and function.
Moving inside, the vagina is a muscular, elastic tube about 3 to 5 inches long when relaxed, but it can stretch during arousal or childbirth. It's lined with mucous membranes that keep it moist and self-cleaning. That's where vaginal discharge comes from, which is normal and helps prevent infections. The walls have ridges called rugae for flexibility. At the top of the vagina is the cervix, the neck of the uterus that protrudes slightly into the vaginal canal. It has an opening called the os, which allows menstrual blood out and sperm in. The cervix changes throughout the menstrual cycle, softer during ovulation, firmer otherwise. Connected to the cervix is the uterus, a pear-shaped organ where a fertilized egg implants. Its lining, the endometrium, sheds during periods. Flanking the uterus are the fallopian tubes, which transport eggs from the ovaries. The ovaries themselves produce eggs and hormones like estrogen and progesterone. Don't forget the hymen, a thin membrane at the vaginal opening that's often stretched or torn naturally over time, not just from sex. It's a myth that it's a seal of virginity.
The vagina isn't just a passive structure. It has vital functions. For reproduction, it serves as the birth canal and receives sperm during intercourse. The acidic pH, around 3.5 to 4.5, kills harmful bacteria while allowing healthy flora like lactobacilli to thrive. During arousal, it lubricates and lengthens via a process called tenting. It also plays a key role in menstruation. Blood from the uterine lining exits through the vagina. For sexual pleasure, the clitoris and vaginal walls are sensitive, with the G-spot, an area on the front wall, potentially enhancing orgasms. Beyond that, the vagina connects to overall health. Imbalances can lead to issues like yeast infections or bacterial vaginosis. It's self-regulating, but factors like hormones, diet, and hygiene influence it. Time to bust some myths. Myth: the vagina gets loose from too much sex. Fact: it's elastic and returns to shape. Only major events like childbirth affect it long-term, and exercises like Kegels can help. Myth: douching cleans the vagina. Fact: it disrupts natural balance and increases infection risk. Just use water externally. Myth: all vulvas look the same. Fact: there's huge variation in size, color, and shape, all normal. Variations include conditions like vaginal septum, a dividing wall, or imperforate hymen, which are rare but treatable. Hormonal changes during puberty, pregnancy, or menopause alter the vagina too. It may dry out post-menopause, but lubricants help. Inclusivity note. Anatomy terms apply to cis women, but trans individuals may have similar structures post-surgery.
For health, wear breathable underwear, avoid scented products, and see a doctor for unusual discharge, pain, or odors. Regular pap smears check for cervical issues. In conclusion, the vagina is a resilient, multifunctional marvel. Knowledge is power. Share this video if it helped. Subscribe for more anatomy breakdowns like reproductive hormones next. Thanks for watching.